Hello, everyone, and thank you for joining us today as we discuss how to enable equity, access, and sustainability of life course immunization through pharmacy-based vaccination. I do apologize about how the background screen is looking. It was just fixed before the webinar started. So just to respect everyone's time, we'll keep going and we'll make sure to address that while we start our session. I'm Sharif Gorgi. I am president of FAP's community pharmacy section, and it is my pleasure to be moderating today's session. We have a panel of great speakers that are lined up for you, and I will be introducing them shortly. But first, I would like to bring your attention to just a few housekeeping items. Please note that this event will be recorded and it will be live streamed on FAP YouTube channel. And if you have any questions, please do use the chat box to provide the questions. We will open up the floor for questions after the presentations. We want to hear from you, obviously, because we always would like to see how we can better provide content that you would like to listen to. So please do provide feedback at webinars@fap.org. And certainly, if you are not a member of FAP yet, we do encourage you to join and become a member. And you can do that by going to fap.org/membership. We also would like to thank Pfizer for their unconditional funding to support this webinar, which aims to provide our members with approaches and tools for tackling key policy enablers that determine equity, access, and sustainability of pharmacy-based life course immunization. The new FIP series enabling equity, access, and sustainability of life course immunization through pharmacy-based vaccination builds on lessons learned from the previous FIP programs, transforming vaccination 2020 and 2021 programs. FIP's vision is a world where everyone benefits from access to safe, effective, quality, and affordable medicines and health technologies. To that end, FIP is committed to supporting countries to develop the policies that enable pharmacies and pharmacists to deliver integrated vaccination services throughout the life course and as part of a wider national immunization policies. So these are the program deliverables. The program will focus on sustainability, equity, and access to life course immunization across the year. It will include a suite of advocacy activities and events and publications. FIP has delivered the first event on the series during the Congress in Seville, Spain, and aims to deliver 5 digital events that focus on accelerating policy in support of pharmacy vaccinators, with the intended audience being senior leaders of pharmacy associations and policymakers. You can watch the previous events on events.fip.org. FIP will also be launching 2 evidence-based publications, one an enabler policy toolkit that captures the outcomes of the events and builds on the FIP advocacy toolkit and all the advocacy delivered in 2020-2021. And the other on pandemic preparedness and the response of pharmacy globally, regionally, and nationally. The program will also see the delivery of advocacy activities, including commitments and calls to action to enable policy for pharmacy-delivered life course immunization. Learning from the work we have delivered, we have identified the key points that include these next steps we take. They include equity and access to the COVID-19 vaccines, but also other vaccines at various stages of life. FIP needs to address how we can mobilize our pharmacy workforce to address the pandemic iceberg of need and change the system to provide sustainable service across the year. So those key points also include defining equity is not possible without the inclusion of all members of society of all ages. Whatever happens through an infant's life will affect their health later in life, as well as the health of those around them. Inequities are cumulative, with an impact on the health of the whole population and on generation after generation. So with that, there is importance of having the political will to set policies in place to make the changes required to achieve equity. And the different communication strategies should be used to reach out to different generations. This event is the fourth event of the new FIP program. FIP is committed to supporting countries to develop policies that enable pharmacies and pharmacists to deliver integrated vaccination services. The success of pharmacy-based vaccination depends on various policy factors, one of which is access to data and vaccination records. FIP data shows that pharmacists' access to patient vaccination records vary widely across countries and regions. Understanding the different models and country experiences is key to a wider implementation. So this event will feature pharmacy leadership bodies from across the world explaining the progress with access to records and how this impacts access to vaccination through pharmacies. So our speakers today are Dr. Umayma Arab from Saudi Arabia, Pedro Silva from Portugal, Marisol Flores Campos from Costa Rica, Dr. Sarah Sorum from the United States. With that, it is my pleasure to introduce our first speaker today, Dr. Umayma Arab. Dr. Arab is a scientific evaluation expert at the Saudi Food and Drug Authority in Saudi Arabia. She earned her bachelor's degree in pharmaceutical science from Saudi Arabia. After graduation, she worked at the King Faisal Specialist Hospital and Research Center. She then moved to the United States, where she earned her Doctor of Pharmacy degree. After that, she completed postdoctoral training in general clinical pharmacy, followed by ambulatory care residency. She is triple American board certified, specialist in pharmacotherapy, medication therapy management, and ambulatory care pharmacy. She has led the MOH SSCP immunization delivery certification during COVID-19 pandemic. She has also served as the chair of the ambulatory care pharmacy specialty network of the Saudi Society of Clinical Pharmacy in 2021-2022. Dr. Umayma, the floor is yours.
Yes, thank you, Dr. Shiri. Thank you so much, FPI, for this kind of invitation. I would like to thank Pfizer as well. I actually today would like to share our success story here in Saudi Arabia. And in our story, I'm going to share challenges that helped us also to improve our programs and the quality of the immunization certification program. With that, I would proceed with the importance of vaccination in general. And that comes from, if you move on to the next slide, you will see exactly that we're talking about vaccination itself and then why pharmacists should be or can be a really good candidate to be an immunizer. So for vaccination in general, it helps us, help our family and our communities. It gives a chance to our newborns to live a healthy and better life, eliminates infectious diseases, also eradicates those diseases that have been for ages infectious without vaccines. It helps us also to travel safely, reduce, I want to say reduce antibiotic resistance, and that is one major importance of vaccination because it reduces the use of antibiotics. It also helps reducing mortality and morbidity. And now why pharmacists are really good healthcare providers to be immunizers. Pharmacists are repeatedly cited to be trusted professionals, considered one of the most accessible healthcare professionals, and have received extensive education about medication. And we know very well product storage, handling, safeguarding inventory, and all the things that happens with all medications. we educate and advocate. So it is time for us to be immunizers in this area of healthcare. Also, we have our extended long hours in community pharmacies, which is available also in every neighborhood. So your pharmacist in the neighborhood will know your cases, your medical health, so will be the perfect person to follow your immunization records and suggesting the scheduled immunization at the time. So all that happened to be really good and the reasons behind pharmacists to being immunizers. So if you move on to the next slide, you will see actually that the Ministry of Health has decided that pharmacists can be part of the team in providing vaccination. So a team was created by the Ministry of Health. The team wrote the protocol and all together, and then it was run by the Saudi Food and Drug Authority to make sure that the rules and regulation has passed by them to make sure all complies to what the Saudi FDA have put in place, especially when we're talking about providing, I want to say, the emergency kits for allergies, for allergic reaction, EpiPen, making sure that those pharmacies have it as part of their licensure in the pharmacy. And then the project was moved to the Saudi Society of Clinical Pharmacy to establish the program. So the program was then in papers, where actually the Saudi Society took it and created the workshop altogether, planned the scientific content, planned the setting, and that happened all together in March of 2020. So it was early in when the COVID hit Saudi Arabia. So after that, the Saudi Society of Clinical Pharmacy took the program to the Saudi Commission for Healthcare Specialties just to confirm that the educational material is there and sound, and we can at this point obtain the CE hours for our pharmacists when they complete their immunization certification. So after that, the program was all ready, and it was named after the Saudi Society of Clinical Pharmacy and Ministry of Health, and ready for activating the pharmacist role in the community pharmacies. So if you move to the next slide, you will see us, the whole team who actually was, actually this is not the whole team, but I want to say those are the people who were the core of the activation of pharmacist role in vaccination. We have clinical pharmacists from ambulatory care specialties, from infectious diseases specialty, all of which are certified by in pharmacy based immunization delivery courses internationally, because this is the first here in Saudi Arabia. We have also had clinical instructors to make sure delivery of safe and effective vaccination, and supervisors to attend all training sessions. So with that, we can move on to the next slide and see how the protocol was written, what happened exactly, and what was in the process. So on the left side of the screen, you can see 3 pictures which are in Arabic. Those are the law and regulation that, not really law, it was a rule and regulation that was passed by the Ministry of Health that allowed pharmacists to be vaccinators under certain conditions. And I'm going to go over it really quickly during this presentation. On the right side, you can see all the resources that we have used for making sure we have a high level of immunization standards to achieve proper vaccination and to ensure administration safely and effectively. We have the CDC, the Advisory Committee on Immunization Practices. We have used the actual protocol that was done by the Ministry of Health. So we have different regulatory bodies who were participating in this protocol. We have also different experts in the matter who are on the team. We have also the international standards that we followed here. So if you move to the next slide, you will see actually how the program was created in segments. So first of all, whoever wants to be part of the certification, or actually let's call them applicants. So applicants register on the website. Can you hear me? All right. So applicants register on the website, take the self-assessment question, and then move on to the didactic portion. And when that portion is completed by the online exam, then the candidate can move on to the next portion, which is the dynamic portion. And after finishing the practical session, training should be almost the pre-final stages, where we check off the pharmacist on certain items that we have on the checklist for making sure that they have completed the full assessment of safe and effective IM and subcutaneous vaccination. And after all that, we administer post-seminar exam to make sure that we have really good quality of the program and ensure taking their feedback on what things that we can improve on. With that being the last part of the training. So upon the completion of this program, there is a certificate that is credited by the Ministry of Health and the Saudi Commission for Healthcare Specialties. If you move to the next slide, you will see the topics that were covered. So it is a total of 8 hours training, continuous hours. If the candidate starts by the first section, it will take about 8 hours to complete the whole section. Now that has been also the actual setting when we had our physical attendance to the program. Now with the feedback that we received, we actually were able to move on to the online portion. If you move to the next slide, you will see how we moved. So at the beginning there, during COVID specifically, we had only 20 pharmacists in the classroom. We had live sessions. We answered all the questions on spot. Now that was really good. However, some candidates were saying that we want to have our hours to do our training at home, especially with the scientific material that they want to learn on their own. So we moved actually to the middle, where it has been recorded, so any candidate can go on, apply, get the certification only for that portion, at least at home, and then move on to the practical. And finally, is that on the right side, it's actually the website. So now the website has been rebooted, updated for the second version, where we can, if you can see the website link down there. If you go and visit the website, it has been all uploaded, updated periodically. The online exam is there, and after completion of the whole process online, then the pharmacist can schedule the appointment and take the practical session on site. Next, please. So at the beginning, we had our training in the 3 major cities, Riyadh, then we moved to Eastern region and Western region. And because of the demand, and that was really, really high, we had sent our clinical instructors to other different areas in the north and the south. You can see all the locations that we sent our clinical instructors to complete the training over. Now, I want to mention here, these are the 9 vaccines that were actually agreed on by the Ministry of Health. So we have only listed 9 vaccines listed here that are to be administered by the pharmacist in the community pharmacy. Now, in the regulation that was passed, 3 things were important. I'm going to mention here. Pharmacy has to be licensed. Pharmacist has to be registered by, at the Saudi Commission for Healthcare Specialties. And the last one is to be certified by this program to provide safe and effective vaccination. Targeted individuals are adults, pilgrims, patients, elderly patients. Until now, we are still covering those targeted population, but I think in the coming few months, we will have expansion to our population. So if you move to the next slide, you will see that we have planned for next year. We have moved to next. Yeah, so we are planning to cover more area, go to universities, and include pediatrics for vaccination by the pharmacies, by the pharmacists in the pharmacies. So these are the ways that we are planning to expand our current status in immunization. Now, these certificates are good for 2 years. It is active with an active BLS, and renewal is over on the website. I think that covers most of the things that we have had with the program for the past 3 years now. And with that, I conclude my presentation. Thank you.
Okay, folks, I do apologize. I'm not sure what is going on with my video here. I'm trying to fix it, but I would like to thank Dr. Arab for that very informative presentation. Certainly a lot of good lessons learned there. And with that, I would like to introduce our second speaker, Pedro Silva. Pedro is a manager of the Health Services Business Unit at the Associação Nacional das Farmácias in Portugal. Pedro completed a degree in pharmaceutical sciences from the Instituto Superior de Ciências de Saúde Norte of Porto in 2005 and completed a postgraduate degree in pharmacy management in 2009. He also holds an executive master's degree in management with specialization in programs and project management from 2005 to 2008. He practiced as a pharmacist at a community pharmacy in Portugal. In 2008, he joined the Associação Nacional das Farmácias and is currently manager of the Health Services Business Unit, where he provides strategic partnerships for financing health services and pharmacies, such as partnerships for flu vaccination and testing for COVID-19. Pedro, thank you for being with us, and we'll now turn it over to you.
Well, thank you, Sharif. First of all, I would like to thank FIP for organizing this session and for the opportunity to be here and share with you the experience of the Portuguese pharmacists regarding the vaccination registration process, the importance that this registration has for a national vaccination strategy, and the challenges we faced in terms of access to information for NHS users. As an agenda, I will start with some background information on the pharmacy coverage network in Portugal, and what we have done to support pharmacists in developing capacity to implement vaccination service, the model established for pharmacists to regular vaccination, the NHS use services. Finally, I will address some of the challenges and opportunities we face in the near future and share what we believe are the key points for life course immunization to pharmacy-based vaccination. As you probably know, Portugal is a small country with around 10 million inhabitants. We have around 3,000 pharmacies all over the country, and of this, about 94% are affiliated to the INEF, National Association of Pharmacists. We are very proud to have one of the most qualified pharmacists in Europe, with an average of 3.9 pharmacists per. So, as a starting point, vaccination service in Portuguese pharmacists was officially launched in 2007 when the Portuguese legislation extended pharmacists' role by allowing the provision of immunization service. Since then, pharmacists were entitled to provide immunization services with vaccines that are not covered by the National Vaccination Program, which currently includes 15 different types of vaccines, such as the flu, pneumococcal, hepatitis, and vaccines. Provide service, pharmacies have to fulfill some requirements, namely related to who can provide the service. In Portugal, since the beginning, just the trained and qualified pharmacists by the Portuguese Pharmaceutical Society are authorized to administer vaccines and injectable medicines in community pharmacies. Nurses can also be hired to perform this task in pharmacy as an alternative. Portuguese Pharmaceutical Society endorsed the specific training and specific guidelines, establishing the minimum requirements for accreditation of initial training that includes live training in injectable techniques, in addition to certification on basic life support. To provide the service, pharmacists also have mandatory recertification training each 5 years. Furthermore, pharmacists also have to have the infrastructures and equipment that are mandatory to provide the service, namely an adequate room, all the materials to vaccinate in a proper and secure way, and also have to have equipment to deal with an anaphylactic event that we call the anaphylactic kit. The ability of the pharmacy network to adapt to the constant challenges of the technological evolution, such as electronic prescribing, allowed pharmacists a strategic approach to the Ministry of Health, earning the trust of the NHS and the ability to take on new challenges. Pharmacists who already registered vaccines on their local software were recognized by the Health Ministry as an important vaccination point against flu, integrated in 2017 automatically the vaccine administration record data from the pharmacy software system on the national e-vaccination building. So now we have local data feeding international central data, just like the NHS hospitals and the health centers. This was an important step that reinforced the integration of pharmacies in the primary health care. With the electronic registration of vaccination, the vaccine bulletin became available for consultation online by the citizen as long as it is registered in the citizen area of the NHS portal. So far, there are about 1.5 million registered users. The dematerialization of the vaccine bulletin brought several advantages, namely reducing costs, avoiding inconveniences associated with losing the paper bulletin, facilitating consultation of the vaccination history, and providing the quality of information. As far as vaccination record is concerned, access to centralized data for vaccination records is still reserved for hospitals and health centers of NHS. The citizen has access to his own data through an app, SNS IT4, that means NHS 24/7, and which in limit allows the user to share his vaccination record with his own pharmacy or his profession. In the pharmacy, the access is limited to the local information from the pharmacy, and the conditions for centralized NHS information we had in place. Therefore, in terms of registering and sending information, pharmacies are at the same level as NHS hospitals and health centers, but regarding access to vaccination records, pharmacies are still limited to local data and information shared by citizens themselves. With data comes evidence, and it is why it is very important to monitor our activity. Collect and analyze data to generate evidence. In this chart, we can see the main results of flu vaccination service in Portuguese pharmacy in the last 14 years. In flu season 2008-2009, the first year of vaccination service in pharmacies, nearly 36% of all dispensed vaccines were administered in pharmacies. And in the last flu season, we achieved the best estimated vaccination rate ever. 63% of all vaccines from pharmacy stocks were dispensed and administered in pharmacies. It is a remarkable evolution. In the year 2018, pharmacists were invited for the first time to collaborate with the National Health Service vaccination as a national service vaccination point. A determining factor for the collaboration of pharmacies with NHS was the ability to share local data into the national central data, just like NHS hospitals and health centers. At the time, a pilot project carried out in 39 pharmacies in the region of near Lisbon. Within the scope of this pilot, elderly patients were able to be vaccinated against influenza in pharmacies under the same terms as in NHS primary care units. And the elderly did not need a prescription, and there was no administration fee nor payment for the vaccine. The aim of this pilot was to increase influenza vaccination coverage in elderly people by improving their access to the vaccine through the contribution of pharmacists. Due to these good results of this pilot, in the following years, pharmacists were again challenged to participate as NHS vaccination points. And we consider that the impact of the pharmacy intervention has been recognized by the NHS, and we continue to collaborate within the scope of the needs defined by the health authorities. Well, when it comes to challenges, we can identify right away from the start some difficulties in coordination between the public and private sectors. The preference for convenience, the proximity, and trust that the pharmacy network provides to NHS users is clear, but sometimes can generate a competition between public and private health professionals. And unfortunately, this can lead to a lack of coordination between public and private health professionals, and the problem of lack of data sharing between pharmacies and the NHS. Vaccination record is one example. Data sharing among health professionals associated with the digital transformation of healthcare represent both a challenge and an opportunity to improve the patient-centered health ecosystem. And finally, we have discussions about health data sharing that reflect multiple perspectives, interests, and even biases. And these tensions need to be acknowledged, and it will be up to the policymakers and also citizens to find compromise solutions that can be implemented in the short to medium term. As I mentioned before, data sharing and the digital transformation of healthcare represent both a challenge and an opportunity. A network of pharmacies supported by pharmacists properly skilled in the provision and registration of health services can serve the NHS as an extension of their healthcare, providing greater national coverage of vaccination response, and at the same time relieving NHS structures, allowing a greater focus of these structures on the provision of more urgent care. Concerning the health spending and vaccination coverage, the pharmacy network can be a major asset. We proved this in the flu vaccination, and the participation of pharmacies in the vaccination against COVID-19 would also have proved it is possible to save on NHS structures, professional intervention, and operational processes. So, as closing remarks, I would like to emphasize that pharmacies are a valuable resource in the health system with the trust of the population. Pharmacy immunization adds value to healthcare and promotes wider coverage of the population. In the Portuguese case, we believe that the value of pharmacists' contribution to vaccination has been increasingly recognized by the NHS, and we are certain it represents gains for all parties involved. And to get here, I can highlight 4 key points. Technological developments, pharmacies and NHS support the submission of centralized vaccine records, access to vaccinate records to both users and health professionals, legal framework for foreseeing vaccination in pharmacies provided by pharmacists, and last but not least, equity in access to the service by the population. The more pharmacies close to the population, the greater the vaccine coverage will be. And thank you very much for your attention. Please feel free to send me any questions you may like. Thank you.
Well, thank you, Pedro, for this great presentation. And thank you for the FIP folks behind the scenes for helping me fix this background. With that, I would like to introduce our third speaker, Marisol Flores Campos. Marisol is Pharmacovigilance Officer at Punto Seguro in Costa Rica.
Well, good morning. Seems that we've had some trouble with my presentation, but no problem with that. My name is Marisol Flores Campos. I'm a registered pharmacist from Costa Rica. And on behalf of Colegio de Farmacéuticos, which is our national professional association, I want to thank FIP and especially the organization committee for such a warm welcome. So let me get started. First of all, with a little facts about Costa Rica. Contrary to popular belief, Costa Rica is not an island. It is actually a small country located in Central America, which would be in the in the bottom of Central America, right before South America. I mentioned it was a small country because we only have 51,000 square kilometers, which is actually very small. As I heard Pedro's presentation, I actually came to figure out that Costa Rica is half the size of Portugal, for example. We only have 5.2 million people as of 2021 living in the country. So that makes for a very small country. As of 2020's global ranking, Costa Rica has the 38th best healthcare system in the world, which is actually, we believe, very good standard for such a small country with such small population. In Costa Rica, vaccines may be accessed both at public and private settings. Public settings being the one that provide most immunization services, but in the private setting, specifically within community pharmacies, pharmacists are permitted by law to vaccinate patients, and pharmacists are also in charge of all tasks related to logistics, supply chain, cold chain control, pharmacovigilance, and proper disposal of vaccines. As of this year, we have roughly 1,300 community pharmacists all over our territory, which make pharmacies a very accessible to patients all over the country. According to a recent survey from our National Professional Association, 71% of pharmacists apply vaccines to their patients in community pharmacies, and 66 of pharmacists report that they keep appropriate records of vaccines that are provided by them. Regarding our topic today about how we record and access vaccination data, first of all, we have this nominal vaccination system, which is called Sinovac. The nominal vaccination system is part of the National Health Monitoring Automated System, SINAVISA, which actually allows for the registration of several mandatory notifications that include not only vaccines, but others such as malignant tumors and infectious diseases. Before this vaccination or this electronic system was available, vaccination records, as well as the other mandatory notifications, were done in writing and were sent paper printed to the health authority. And we didn't actually have like a proper transition between the paper-based system and the electronic reporting system. So as you see in the slide here, this nominal vaccination system, what it does is that it integrates data of all the vaccines that are applied in the country, and one of its main goals is to actually get to record 100% of vaccinations that are applied in the country. And this system also allows the health authority to monitor or to comply with its strategic monitoring functions. So that's the main basis for our vaccination record access system. This is a screenshot, a simple screenshot of what you would see if you actually accessed our daily immunization registration that is available for community pharmacies. So first of all, let me say that one of our main issues actually is that the access to this system is given specifically to each pharmacy. That said, user registration depends on each pharmacy, and access codes are not given individually to each professional. I will detail about that a little later. So this would be the main access to the system. Pharmacists at the community pharmacy would then have to write down all the patient's information in the blank spaces, including ID number, full name, gender, and their current address. Unfortunately, this is all the information you can access in the system. Previous vaccination records are not visible, nor any patient medical records are accessible or readable for us. So this makes for a little bit complicated for us to recommend or provide further immunization services, given that we don't have full patient information at the time of the immunization. So regarding policy and impact, let me start by saying that prevention and control of diseases that are vaccine preventable has always been a public health priority in Costa Rica. Policies include a universal vaccination scheme and have a solid legal basis. Our legal basis started in 1973 with the General Health Law, which included just a couple of very basic articles regarding immunization. Then we had the National Vaccination Law in 2013, the National Vaccination Norm that I will detail a bit later. And finally, in 2017, we had the Health Monitoring Regulation. This regulation from 2017 is actually the regulation that specifically regulates today's topic, which is vaccination records. But I do want to say that even before the health monitoring regulation from 2017 existed, pharmacists had already been applying vaccinations in community pharmacies for decades. So Costa Rica is more of like clinical practice comes first, and then this regulatory decision-making comes later. So this is something very important about our local context, that we usually do things first and then we regulate later. So that may be maybe a little bit different from how other countries are governed and how things actually work. But going back on the national vaccination norm, I really have to say that this may be the single most important policy regarding vaccination and vaccination records. For the first time, this regulation provides pharmacists with all the technical and operational guidelines on how to provide immunization services at a community pharmacy level. And it also establishes definitions and legal requirements for all immunization services providers, including pharmacists, of course. It also includes all the components that guarantee vaccine safety and efficacy. And regarding pharmacies specifically, it also includes all the responsibilities regarding pharmacovigilance, supply chain, and cold chain as a whole. And also this regulation organizes all the national information system regarding vaccination coverage and is the basis for the nominal vaccination system that I mentioned before. So this is the first time in our regulation that it is actually stated that pharmacists are required to register all vaccinations that are applied by them at a community pharmacy level. And regarding a question that I was given by the organizers, does this national nominal vaccination system, does that actually have an impact on vaccine coverage? It would be hard to answer that question. I would think rather than vaccine record access, the legal basis or strong legal basis that also requires vaccines to be mandatory for patients cannot really be measured. We would have to look at the whole context and not focus only on vaccination data access, but more of a of policy as a whole in the country. So regarding this question about what tips for other countries to adopt regarding vaccination records, I would say that first of all, what we believe is very important to make a thorough national context analysis. As I mentioned, for example, we have this very particular way of doing things, which we usually first start doing things and then we regulate them. So that would not necessarily apply to every country, but I find so many things in common with things that the previous panelists have talked about, that I think it would be also very important to consider other countries' knowledge and accomplishments and all the know-how that they have been developing during their years and all the experience. Also, considering Costa Rica's experience specifically, pharmacist experience is invaluable for drafting new regulations. I'm not saying that necessarily you have to start doing first and then regulate, but if you can take into account all the pharmacist experience in records and vaccination and immunization, I think that would be something highly valuable for whatever goal you have in mind. It is also very important to consider that both health authorities should collaborate with professional associations so that they can issue comprehensive guidelines according to the local context, and that proper guidelines are issued and are audited and everything, so that everyone knows them and knows how to apply them correctly. And maybe our last consideration here is that not having a formal registration system should not be an obstacle. As I mentioned before, many years before we started applying vaccines, we didn't have a proper electronic registration system, but we kept our records by hand. So that has provided some information that is actually very valuable now. And just if you don't have a computer, if you don't have a proper registration system, don't let that be an obstacle and start recording all the vaccinations you apply in a pharmacy level as of today. and don't let anything stop you with that. Regarding what our National Professional Association, what has been done, we have started communication with the health authority to improve the current record system, to make it more user-friendly. And we have also worked with pharmacists requiring feedback and applying surveys so that we can actually know what is happening in day-to-day. We have also started research to figure out how much is the contribution of pharmacists to the national vaccination rates. And as I mentioned before, comparing what is being done in other countries, we are also working in training, specifically trying to figure out what the best training for service guidelines are and what the best training for vaccine record is also. And that's what we have been working on mainly. And finally, regarding our opportunities and challenges in our local context, specifically regarding vaccination records, we have found, as most of you, that formal training in immunization services and vaccination records is very important to us, not only at an university level, but also as continuing pharmaceutical education. We have also asked the health authority to reconsider the system user registration and credentials. As I mentioned before, we believe it would be better if each professional had their own user code or their own access, so that if they move from one pharmacy to another, they can keep track of their patients and make sure that every vaccine that they apply is actually recorded in the system. We would also really hope for having access to patients' basic clinical record information and previous vaccine records, so that would be critical for a better, pharmaceutical assessment and for recommending further vaccinations. And finally, we believe that our current electronic system is not actually very user-friendly, or at least this is what the last survey from our national association data shows, that people ask for a more user-friendly version of the system so that it would be easier to record or register each vaccination that is actually applied at the community pharmacies. So that's it on my behalf. Please feel free to contact me if you have any further questions at the end of the presentations or via email. Thank you.
Thank you, Marisol, for this great presentation. Certainly, there is a lot of information there to help inform the work in other countries. And folks, I do apologize again for the technical issues I was having, and thank you for your patience with that. I guess maybe in a weird way, it explains why it's not that straightforward to have a full system of digital vaccination records everywhere. With that, I would like to introduce our fourth speaker, Dr. Sarah Sorum. Dr. Sorum is the Executive Vice President and CEO of the Pharmacy Society of Wisconsin in the United States. She is a graduate of the University of Wisconsin-Madison School of Pharmacy. She has provided patient care through workplace chronic disease management services, comprehensive medication review programs, immunizations, long-term care, hospice consulting, and transitions of care services with clinics. She is passionate about the role of pharmacists and pharmacy technicians in public health. Dr. Sorum joined the staff of the Pharmacy Society of Wisconsin in 2007, and throughout that time has taken on expanded management and operational roles, and was named as the Society's CEO in May of 2020. Dr. Sorum has demonstrated leadership in immunization access expansion and equity, working for the past 10 years on grant-funded projects with state and federal partners. her systems change advocacy has been featured in journals, conferences, and in media. So, Dr. Sorum, thank you for being with us, and we'll now turn the floor over to you.
Thank you so much. I'm so pleased to be joining you all. Today in the United States is Groundhog Day. And for those of you who that's a new holiday for, Groundhog either comes out and sees his shadow, and that means we have 6 more weeks of winter because he gets scared and runs back in his hole, or he doesn't see his shadow and spring comes early. Well, the groundhog saw his shadow this morning, so we have more winter ahead of us. I'm joining from Wisconsin, where we're in the winter season, and it's 6 degrees Fahrenheit outside, so it's cold outside. I'm so glad to be with colleagues across the world this morning. I wanted to focus on our experience at the state level, but also provide you with a United States perspective on pharmacy-based immunization records. In the United States, our immunization information systems are specific to states. So there isn't a national IIS system, and each individual state has its own information system that mirrors the authority of pharmacists and pharmacy technicians to vaccinate. That authority is granted at the state level. So pharmacies, as we've heard from multiple countries, provide really important access to vaccination, and having the ability for pharmacies to report to information systems as seamlessly as possible is critical. And we've found in the research that we've done that the more seamless that process is, the more timely the reporting takes place. So leveraging technology as much as possible versus manual reporting to an IAS system is preferred. So there are still many pharmacies in the United States that are doing manual entry of an immunization record, one patient at a time. Typically, they're leveraging administrative staff, pharmacy technicians to support that information. And certainly in times where vaccination is at its peak, for example, during COVID vaccination rollout or influenza vaccination season, those times it's very challenging to keep up with the pace of that manual reporting. So we've really worked to try to provide as much as possible easy ways for pharmacies to work with their state administration to make that reporting as turnkey as possible. So many of the larger organizations now will submit like a flat file to their state to have uploaded, or they'll have that almost be somewhat real-time reporting. The challenge is that when there are errors with that file that's uploaded, let's say a piece of data is missing from a particular entry, that then is categorized as an error, and there needs to be some action by pharmacy staff to correct that record. And so where there's incorrect pieces of data, that information then is not uploaded, and we encounter some serious issues with timeliness. So I mentioned that we've done some research at the state level on timeliness. The best format that we seem to find for timely reporting of data is the HL7 submission format, and that helps with the timeliness and correct entry of data. So we looked at this in particular at the Wisconsin state level. Our information system for immunizations is called the Wisconsin Immunization Registry, or WER, and the method did impact the timeliness of reporting in our state. And I would say this is applicable to other states as well. So we have also found that with the siloing of different state records and the siloing of pharmacy records, that communication across systems is really important. So in the United States, health systems will have their own electronic health record. I actually live in the town where Epic is located, the international headquarters of Epic. And a health system that utilizes an EHR will have a way to access the immunization registry information and ping that for uploading into the clinic sphere so that other healthcare providers can see that data. However, in many cases, that needs to be like an active step that the clinician takes or that the system takes. So the ability for that health system to see the records that were imported by a pharmacy outside of that system relies on that reconciliation of data with the electronic health record. So really, it's not just for, in our experience, the reporting of the data, but also the systems that are used to access the data by other healthcare professionals or other pharmacies. So the other issue from a siloing perspective is that because our country has state-specific immunization information systems, there isn't necessarily automatic communication between state information systems. So if you have a patient, for example, that lives on the border between our state and the state next to us, they may receive immunizations, in both states, or they may receive immunizations where they live, but they visit a clinic in the other state, and that those information systems aren't necessarily communicating with one another. So individual states have set up individual communication channels and technology information sharing across state lines, but that is all specific to individual states. So it's a very time-consuming, bureaucratic process to have that access. And then I wanted to share a couple of other key takeaways. So we're talking about facilitators to pharmacy-based immunization. I think another important thing to note, and Marisol referred to this, is that the immunization reporting isn't what's reported as a top barrier for pharmacists to vaccinate. So even without the ability to have seamless reporting, that isn't the number one barrier that pharmacists in the US will say is a barrier. And for us, actually, it's financial. So we did a little bit of research on what pharmacists rated as the top barriers for vaccinating. And these were the major barriers that were shared in the United States for vaccinating. And you'll see that immunization data reporting was not a top barrier. Now, if you ask this same question of other healthcare professionals, physicians, others, they'll indicate that one of their top concerns about pharmacists vaccinating is accurate reporting of that information and sharing immunization data between healthcare professionals, so that when a physician clinic looks at a patient's immunization record, it's a complete record and includes the vaccines that they've received at the pharmacy. So we have found that it's been essential in order to get buy-in from other healthcare professionals, and really it's the best thing for the patient to have accessible and accurate immunization records. And that increases the confidence of other healthcare professionals that pharmacists play a key role in vaccination. The other thing that I think is important, Marisol also referred to this, is the ability for pharmacists and pharmacy personnel to access training about reporting and checking the immunization registries. So just 5 years ago, pharmacists in Wisconsin had to in person attend an immunization registry training. They had to take a day off of their patient care responsibilities and go on site to an immunization registry training program. Well, now we've worked to try and streamline that program, shorten it, provide it virtually, and get as many people as possible trained to do the reporting. And that's been a facilitator versus a barrier. So I'm happy to take questions. I think we're transitioning to the panel discussion. Really, again, appreciate all of the work that is being done to increase immunization access.
Thank you, Dr. Sorum, for this great presentation. With that, we will now open up the floor for questions from attendees. So if you do have a question, please do type it in the chat box. And would also ask all the panelists to please get your video started and join us. Thank you. Maybe while we wait for some questions to come in, I think one of the challenges in some jurisdictions is mostly having the political will to be able to implement this type of digital access for vaccination records in place. So maybe just opening up for some of the panelists there, based on the experience in your region, how much work did you have to do with policymakers in order to be able to get this in place, and maybe other stakeholders as well?
Sharif, for us, the work came with trying to get immunization authority for pharmacists and now pharmacy technicians. So having to pass legislation to enable the ability to vaccinate. And once that ability to vaccinate was in place, the information reporting, in some cases actually, and for us, it's a mandatory reporting. So in Wisconsin, as part of our authority to vaccinate, you have to report the vaccines you provide within 7 days of administering the vaccine. And frankly, we're the only healthcare provider that has that requirement. So it seemed like it was an enabling factor to gain the authority was to require the reporting. And that's similar in other states as well.
And I appreciate that. I think the reporting piece probably is the most straightforward piece in that. Like you said, I think, from a pharmacy perspective, I think we have the I would say very straightforward way of doing that through entering the records and billing them through the public payers. But I think the other part of that is actually accessing those records and accessing the other vaccination records for the patients, and kind of looking at the full picture. And I think that's what would require some sort of investment from governments to be able to allow for that digital access and for healthcare providers. These are conversations that in some jurisdictions have been going on for decades, and it's just a bit challenging to kind of move the needle forward on them. So, do you have any ideas, tips, or insights on how we can approach that?
Regarding what you said, I think maybe, and I would dare say that it's the same thing for most countries, like being able to keep policies and systems up to date. Like we do have something, but it's not revised as often as it should be. So maybe we have a system that worked properly 15 years ago, but it doesn't work properly now. So it takes us ages, to update and revise and reconsider what types of updates we should be making, and not waiting for a pandemic to consider if things should be changed, right? So I think maybe one of the biggest obstacles is that we don't necessarily program updates or revisions, like permanently. We do that only when there's like an emergency situation that we must respond to. So I think that maybe that would be something good that we could work on, like to actually consider as, for example, professional associations to review all our guidelines or policies or whatever every, 4 years or 5 years, so that we're sure that everything is up to date and not just responding to an emergency situation.
Yeah, I fully agree, and I think this is certainly one of the lessons learned, from that pandemic. Is there anybody else who would like to weigh in on that question?
Yes, actually, I would like to add, and I agree with Marisol, because that actually happened with us. So here in Saudi Arabia, I think we are one of the largest countries here who actually enable pharmacists to give vaccines in community pharmacy. But that happened. The agreement happened right before COVID. So probably COVID actually pushed it for a sooner activation of the pharmacist role here in Saudi Arabia. Yeah.
Perfect. Thank you. Looking here, I see you have a question that is directed for each panelist. What is the percentage of pharmacists who are now able to provide immunization in your respective country? So maybe Pedro, we'll start with you.
Yes, thank you, Sharif. I cannot give you a straight answer regarding the pharmacists, but I can give you an answer in terms of the pharmacies that have the service available. We have roughly 75% of the pharmacies with the possibility of providing the service of vaccination in our country.
Thank you, Pedro. Dr. Sorum?
So with the authority being state-based authority, each state has different allowances for which vaccines can be provided and what ages of patients can be vaccinated. However, we are at a point now where every state does have some authority for pharmacists to vaccinate. The other development, though, in the last 3 years has been trying to engage pharmacy support personnel in vaccinating. So the pharmacy technicians or the individuals that work alongside the pharmacist under the delegation of a pharmacist being able to vaccinate. Because of the quantity of vaccinations being done, the pharmacist didn't necessarily need to be the one doing all of the vaccination. They need to be the one that determines who's vaccinated with what vaccine, but the actual vaccination could be done by support personnel. So we are seeing more and more states now, and we're one of them, where the pharmacy support personnel, the technicians, are able to vaccinate.
And did you see that this was able to increase the levels of vaccination records?
Absolutely, yes. And I think your point about not only the reporting, but the accessing of data is important, and having delegates where the pharmacist can delegate to an administrative support personnel the checking of the record under that pharmacy allowance, being able to look at the immunization record. Our immunization records will, say this patient is due for these 3 vaccines. So the administrative personnel can access that information and look that up for the patient.
Right. Well, thank you for that. Marisol?
Well, in Costa Rica, every pharmacist that is in charge of a community pharmacy is allowed by law to apply vaccines in that community pharmacy setting. So that would make, each pharmacy could do it. According to our latest survey data, approximately 77% of pharmacists do give vaccinations at, at their community pharmacy. I would guess that maybe there are smaller pharmacies and, like different commercial settings that they don't usually carry vaccines, but I would say close to 80% of pharmacists actually do apply vaccines at their pharmacy. And contrary to the US, we don't have the pharmacy technicians at all. And none of pharmacist vaccination or immunization services tasks can be delegated. So pharmacists only tasks, and still we have, I believe, a very good coverage, and we have a good amount of pharmacists considering our population density and stuff. So our coverage in the private setting is quite good, I believe.
Thank you, Marisol. And it's always interesting to see the difference in the scope between different jurisdictions, and there are always opportunities to look at doing things differently, I guess, based on everyone's needs. Dr. Arab?
So here in Saudi Arabia, we're still doing baby steps, and we're trying to monitor the numbers of pharmacists who are certified. And since we launched, we have reached about 500 pharmacists. Now, I don't know how big or small this fraction is from the number of actual pharmacists in the country, but we have those 2 major, or let's say large retail pharmacy chains in Saudi Arabia that are in contract with the MOH. So they have to fulfill these contracts to make sure that all pharmacists in their branches covering vaccination for our citizens and residents.
Thank you, Dr. Arab. There is, I'm seeing another question that has been inputted in the chat. What steps should be taken to solve the issue that the financial barrier prevent from getting vaccinated? I'm assuming that they probably either the financial barrier from if people would pay out of pocket or for private, because I think for a lot of the different vaccines, I guess, but maybe that will also depend on the jurisdiction. In some countries, it's mostly public payers are the government would cover that. But maybe the question is from a jurisdiction where that's not the case. So do you have anyone would like to take on that question first?
I'm happy to speak to this from a perspective of a jurisdiction that doesn't have one payer. All of the immunization payment policy is determined specific to a payer. And historically, those payers, those insurance plans, were only paying for immunizations that occurred by other healthcare providers in a clinic setting. So it's really only been as the authorities expanded that those payment policies have changed. And because we're not necessarily seamlessly submitting medical claims for immunizations, some health plans have not added the immunizations to the pharmacy benefit side of things for easy processing at the pharmacy. So I think one enabling it would be the policy enabling pharmacies to submit vaccination claims as they do prescription claims for as easy as possible submission, and that the payer then recognizes the pharmacy, and not just some pharmacies, but all pharmacies, as places where vaccinations can be provided. It's amazing to me that that still is not the case, especially after the 3 years that we've been through with all of our COVID vaccines in the states were paid by the federal government. So there was just one payer. And we saw that enabled vaccination to take place and enabled equity and accessibility. We still have lots of challenges with that, but it was enabling. And so now that we're reverting back to policies that existed pre-pandemic, we're seeing those financial barriers again.
So I guess what you're seeing is that when the more vaccines are covered publicly, the higher the vaccination rates. And so basically, based on that question, there is a barrier for vaccination if someone has to be paying out of pocket.
Yeah, that's the number one barrier that we see from pharmacies, is the financial implications of billing, reimbursement, patient costs. Those are all the number one barriers for us.
Thank you for that. Anyone else would like to weigh in on that question?
I think it depends, of course, on each country, as you mentioned. Small countries like Costa Rica are not vaccine manufacturers. So if you're in a context like ours, I would consider that you make, deep research regarding taxes, import taxes for vaccines, and if there's a possibility to give any sort of tax exemption to pharmacies that actually do apply vaccines. So that would maybe, be like, how could I say that it would make it more commercially viable, that more pharmacies actually want to do or want to apply vaccines at their site or at their establishment, given that they will be given some sort of recognition or decrease in tax payments. I think that always goes well. But not only consider, the product's taxes, if they do have it, but also how to give some sort of, advantage to pharmacies that actually do provide these services, and have some sort of exemption from all the taxes that they have to pay.
Very interesting. Well, thank you, Marisol.
Sure.
Pedro, Dr. Arab, any last words on that?
Well, we have a prescription-based vaccine system in our country, in which the NHS supports part of that cost to the citizen. We have an important pilot project that that I mentioned in my presentation, where the elderly have an access to the vaccine without prescription. This in terms of the flu vaccination. And of course, this simplifies the process, because the citizen does not have to go to the doctor, get the prescription, and go back to the pharmacy to get vaccinated. This produces very good results in terms of the simplicity of the process. But the finance is always, and will always be a problem here, because the payer, the NHS, the citizen is also, it's the payer with their taxes is always going to be a problem with the questions regarding including new vaccines in the national vaccination program. This was always going to be a challenge.
And that's certainly a challenge. I can probably safely say that it would be shared in most countries and jurisdictions. Dr. Arab, any final thoughts on that?
Actually, we have only, I mean, majority of the vaccines are covered by the Ministry of Health, just because it's part of the preventative medicine that we have as one of the aspects of the vision realization in 2030. So, so far we have a lot of coverage, and we have also, again, similar status, other payers, insurance companies and stuff like that. So it's mixed between both, yeah.
Perfect, thank you. I think we have time for one more very quick question. I think we did get it. Who trains a pharmacist for the vaccination program?
So in Saudi Arabia, the pharmacy-based immunization training and certification is a program that was built by pharmacists who have experience in immunization. For example, myself and my colleagues, actually, we graduated from the United States, so we have had our APHA immunization certification, and I actually practiced in the pharmacy over there. So we got our network together and have our pharmacists who are experts in this matter. We also use nurses' help. We can never go with such a training, large training program without nurses. So clinical instructors were really a big help in our case.
Perfect. Thank you, Dr. Arab. And I guess, Dr. Sorum, I would assume that Dr. Arab did cover what's happening in the States in her answer, or do you have anything further to add to that?
Just that usually our authority is based upon a training program, and the state will specify what training program is allowed. So the APHA, the American Pharmacists Association training program, is a common one, but any school of pharmacy typically now is incorporating vaccination training for students, and then that provides the authority when they graduate.
Thank you. Marisol, any?
I think locally, that is one of our biggest Achilles tendon. We still haven't figured out how to articulate universities with the health authority, with the National Professional Association. So as I mentioned in one of my slides, that is something that the Colegio de Farmacéuticos, which is our national association, is actually working on as of now, figuring out what the best training program or certificate or whatever would be the best option for us, so that we make sure that students are properly trained and with a standardized training in all the different universities, and also that continuing education is required if you're in charge of immunization services at your community pharmacy. Is something that we still haven't fully figured out yet, and we're working on that. So if you have any input you can give us, that is always something very valuable for us.
Perfect. Thank you very much, Marisol. And I think we're right on time. So with that, I would like to thank all our speakers today for the very insightful presentations, and would like to thank everyone for attending, and thank you for your thoughtful questions. And just before we sign off, I would like to remind you to please check all future FIP digital events at events@fip.org. And also please do share your feedback with us at the webinars@fip.org. And with that, thank you everyone, and have a great rest of your day.
Thank you.